Hello and welcome to the annual general meeting of the NHS Humber and North Yorkshire Integrated Care Board. My name is Jason Stamp. I'm the acting chair of the ICB and I'm privileged to welcome you today. Whilst today is about celebrating our success and achievements over the past year, I want to take some time just to talk about the current context and landscape in which we are currently working. You may have seen recent headlines around changes to the NHS, and I wanted to touch on those in terms of Humber and North Yorkshire. The government has announced its plans to abolish NHS England and merge this back into the Department of Health and Social Care, and there will be a radical shift in the way that the NHS is managed and how services are delivered in the future. There is a huge challenge for integrated care boards like ourselves. We're being asked to reduce our running and programme costs by around 50% and actually develop something which is called the Model ICB, a national blueprint that redefines the purpose, functions and capabilities of integrated care boards like ourselves. The scale and speed of change are significant and breathtaking for NHS England, ICBs and our providers. However, it would be remiss not to mention these upcoming changes. The purpose of this AGM is to look back on the year leading to the 31st of March 2025. I want to touch on some of those key achievements. We focus quite a lot on problems, but we have made significant progress both as an ICB and as a wider partnership over the past year, and I'm very pleased to share these achievements with you. We began the year with the launch of our refreshed and simplified integrated care partnership strategy, and it set out our renewed commitment across the ICB, our partners and 6 geographies to narrow the gap in healthy life expectancy by 2030 and increasing healthy life expectancy by 5 years by 2035. Improving outcomes for our local populations across all of our communities remains our key priority. This integrated strategy was shaped by extensive collaboration, engagement and participation of a huge group of stakeholders, including our providers and most importantly, local communities. The strategy isn't just a document, it's an ambition. It's a call to action for all of us to improve life expectancy and close the gap in health outcomes for the people that we serve. Delivering on the strategy is our biggest priority. It creates a culture across all organisations and partners to actually work with people and empower them to improve their lives. It's about building closer connections with each other, with our colleagues and with our partners. No organisation can do this alone. It's about being creative and innovative. It's about finding new solutions and new ways of working that will help us make the bigger difference faster and actually have a longer term impact. This year also saw the launch of our organisational values. We care, we connect, we innovate. These aren't just words. Every day, the decisions we make and the actions we take, we are committed to living those values. Over the last year, our board has worked hard to strengthen governance structures, ensuring accountability and transparency in everything that we do. We have really focused on building strong partnerships with local authorities, healthcare providers, voluntary and community sector organisations, and most importantly, our local communities. And those partnerships have been instrumental in driving forward our shared strategic aims and bringing about the change that we see today. As we reflect on the past year, we're proud of the progress we've made, the resilience shown by our teams collectively to deliver our strategy, and the firm foundation that we've laid for the future. We know that the next year is going to be extremely challenging, but through our collaborative efforts and our strategic initiatives already underway, we're confident that our teams and partners will continue the journey towards a healthier, more equitable future for all residents across Humber and North Yorkshire, whether you live in Harrogate, Hull, Grimsby or York. And as we navigate ongoing uncertainty, our core commitment remains unchanged: to improve health outcomes, to deliver high quality, innovative, integrated care, and to do so in a way which is responsive, compassionate and sustainable. Finally, I want to close this introduction by offering my heartfelt thanks to all of our partners and colleagues across our system. This really has been a joint effort. Thank you for your hard work, your compassion and your dedication to realising our shared ambition, a healthier Humber and North Yorkshire. You're now going to hear from the Acting Chief Executive, Teresa Fenwick, who will be sharing some of the key highlights and achievements from 2024-25, and from Des Irving-Brown, the Executive Director of Finance Investment, who will give an overview of financial performance over the past year.
Hello everyone, I'm Teresa Fenwick, Acting Chief Executive for Humber and North Yorkshire ICB. As we reflect on last year, I want to start by recognising the incredible work that's been delivered across our system. The challenges have been real and at times relentless, but so too has the commitment, resilience and dedication of our teams. Our core focus has remained unchanged, delivering high quality NHS and care services for our population, using our resources wisely and supporting our workforce to thrive. NHS England set us some ambitious targets for improvement, particularly around urgent and emergency care. And I'm proud to say that we've made strong progress, but it's not been easy and there's more to do. This year, like many others across the country, we've felt the effects of industrial action and ongoing workforce pressures. Despite this, our staff and partners have consistently risen to the challenges. We've worked hard to manage our finances carefully, maintain standards of care, and keep our services running through difficult times. We know that there's more to do, particularly around urgent care, ambulance response times, and to reduce waiting times. That's why we've welcomed the additional support that comes with our Tier 1 status. It reflects both the scale of the task ahead and the confidence NHS England has in our ability to improve. Technology and data have played an increasingly important role in how we plan and deliver services. Platforms like the NHS Federated Data Platform are helping us to make smarter decisions, to focus on outcomes and to build a culture of continuous improvement. But if we want to keep delivering universal, high-quality healthcare, we know we need to go further. That's why we've started a bold new programme of change we're calling Design for the Future. It sets out a clear ambition to build more integrated, accessible local services that identify people's needs earlier and to respond more effectively, with emergency care provided at our acute sites and more support available in the community. It also aims to create a more flexible, agile, integrated care board, one that can respond to the changing health and care landscape and ensure every part of our system is working together. None of this would be possible without the people. So I want to say a sincere thank you to all of our colleagues, partners and volunteers across Humber and North Yorkshire. You've shown extraordinary commitment and compassion. Let me now share just a few of the highlights from this past year. Firstly, tobacco control. We've continued to lead national efforts to tackle the single biggest cause of preventable death: smoking. Our Centre for Excellence in Tobacco Control has worked closely with local authorities and health professionals to advocate for the tobacco and vapes bill, raising awareness and influencing change at the highest levels. In March of this year, and in partnership with 15 local authorities across the north, we launched Yes to Quit, a powerful new campaign asking people, what will you miss more than smoking? Whether it's weddings, births, or times with loved ones, it's helping people to see what is at stake and to make that first step towards quitting. We've also deepened our commitment to the Armed Forces community. On the eve of Armed Forces Day, we were proud to receive the Silver Award for the Defence Employer Recognition Scheme. This recognises the support we provide to veterans, reservists and their families, and the steps we're taking to ensure that they feel seen, valued and supported. In Catterick, a major new health and care development is now underway. Construction has begun on the first of its kind joint facility between the NHS and the Ministry of Defence. This new integrated care centre will deliver joined-up services to both military personnel and the local civilian population, improving care, improving access, and strengthening our commitment to those who serve. We've expanded access to diagnostics through our community diagnostic centres. Our new community diagnostic centres opened in York, Grimsby and Scunthorpe, joining existing sites in Ripon, Beverley and Selby. These centres are providing faster access to vital tests for conditions like cancer and heart disease, cutting waiting times and giving people the answers that they need sooner. Further community diagnostic centres are coming soon in both Scarborough and in Hull. In July, we launched our Centre of Excellence for Frailty. It builds on the excellent work of the Jean Bishop Integrated Care Centre in Hull and aims to improve the way we prevent, identify and manage frailty. With an ageing population, this work is more important than ever, and our goal is to ensure every older person in our region receives consistent, high-quality care no matter where they live. We've also taken a bold step to address suicide. In September, around World Suicide Prevention Day, we launched a new action plan. This was developed with partners and aims to change the narrative around suicide. It focuses on those at greatest risk, improves crisis support and challenges the stigma that still surrounds mental health and suicide. We want everyone to feel that they can talk openly and honestly about how they are feeling and to know where to turn to for support when they need it most. We've started to unlock the power of data with Connected Humber and North Yorkshire. This is a new system-wide programme to help us use data more effectively to improve care, starting with children and young people. By sharing secure, real-time information between services, we can reduce duplication, improve coordination, and create a more connected, person-centred approach. Pilot projects in York and North East Lincolnshire are already showing real promise. And finally, we listened. In October and November, we invited the public to take part in We Need to Talk, a major engagement campaign asking people what matters most to them and how they want NHS services to change. Over 3,000 people shared their views, and we've published a full report with their feedback. That insight will shape how we plan for the future, because if we want to build services that really meet people's needs, we need to start with what people tell us matters most. So as we look ahead, I remain both proud of what's been achieved and clear-eyed about the challenges still ahead. The pace of change in health and care is not slowing, but neither is our ambition. With the right leadership, support and determination, we can keep improving services, tackling health inequalities and delivering on the promise of integrated care. And we'll do that by continuing to listen, to work together and to put people at the heart of everything we do. Thank you.
Hello, I'm Des Irving-Brown, Executive Director of Finance and Investment here at Humber, North Yorkshire ICB. I'm going to talk through some of the financial elements of the 2024-25 annual report. I'm going to cover two main statements within the ICB statutory accounts, namely the Statement of Comprehensive Net Expenditure, which is sometimes referred to as the Income and Expenditure Report, and the Statement of Financial Position, which is the ICB's balance sheet. These statements, alongside the other two core statements of changes in taxpayer equity and cash flows for the year, and the accompanying notes, can be found in the statutory accounts at the end of the annual report. I'm then going to pick up performance against some of the key ICB financial targets concluding with the opinion of our external auditors, Orbis Mazars LLP, on the statutory accounts. The table on your screen shows the ICB statement of comprehensive net expenditure, both for the financial year 2024-25 and for the previous year 2023-24 for comparison purposes. It should be noted that, compared to the equivalent statements from, for example, limited company accounts, the ICB income is small compared to its expenditure, resulting in the ICB posting a substantial net operating deficit. This is normal for government entities, as we receive funding allocations to cover our costs rather than needing to raise sales invoices. We will cover our funding allocation later in this presentation. Our operating income from goods and services, totaling £134.7 million in 2024-25, arises mainly from patient prescription fees and charges, patient dental fees and charges, and recharges to one of our local authorities for their share of partnership working costs we manage. Within the operating expenditure, nearly all of our costs arise from the goods we buy and the services we commission across our geographical area for the healthcare needs of our local population. For the financial year 2024-25, this totaled £4.4 billion. Taking our income and expenditure together, the ICB's accounts show a net operating deficit of £4.3 billion. We will go into a bit more detail about what all this money was spent on in the next slide. Here we see that just over half of our costs, totaling nearly £2.2 billion, arises from the services commissioned from acute care providers. These are the services on the whole that you access through going to a general or specialist hospital, such as the emergency department or planned operations. The next highest cost arises from the healthcare services commissioned from primary medical services. In 2024-25, this cost £581 million and accounted for a further 14% of our costs. Primary medical services include GP surgeries, as well as dental services and optometrists. Mental health services, community services, and prescribing each roughly account for a further 10% of our costs, costing around £400 million each per year. When looking at the ICB Statement of Comprehensive Net Expenditure, you will notice that the deficit position, when compared to the previous financial year, has increased by £292 million. This increase was allocated to the ICB by the government to cover increased costs compared to the previous year. There are a variety of drivers of these financial pressures, which include the increasing number of patients accessing healthcare, the cost of living and other inflationary pressures on buying medical goods and clinical services, staff pay awards, new drugs, and new ways of delivering care. This slide shows the Statement of Financial Position of the ICB as at the end of the financial year on the 31st of March 2025. For comparison, it also shows the position 12 months prior at the end of the previous financial year. This table shows that the vast majority of the ICB's assets arise from outstanding sales invoices raised or due to be raised but not yet paid. This totals £19.4 million. You can see that this position has improved compared to the previous year, as the ICB has less outstanding debt. Keeping a tight control on the timely raising of sales invoices and ensuring they are paid in a timely manner ensures the ICB can pay its suppliers in a timely manner too. Within the ICB's total current liabilities, the vast majority arises from outstanding purchase invoices awaiting payment or expected to be received, which relate to the financial year 2024-25. This totals £275.6 million, and again you can see that this position has improved on the previous financial year. Moving on to the financial targets the ICB is expected to achieve, probably the most important is that our ICB operates within the resource allocation we receive from the government. The resource allocation is divided into three separate strands. There is the overall allocation target, which for the 2024-25 financial year was £4.261 billion. The table shows that the ICB achieved this target, i.e. it did not exceed the allocation. Secondly, there is the capital funding allocation target, which for 2024-25 was £141,000. Again, the ICB did not exceed its target allocation. And finally, there's the administration costs of the ICB allocation target, which for 2024-25 was £32.47 million. You'll note that the ICB's actual costs against the target were less by £1.265 million. This funding was then used to pay for more healthcare services and to benefit the local population and patients. In order for the ICB to achieve the allocation targets just discussed, all ICBs are required to become more efficient in the delivery of healthcare services locally. This efficiency target is mandated by NHSE via an efficiency factor applied when calculating the resource allocation at the beginning of the financial year. This efficiency factor, plus the further pressures identified locally, result in the ICB's overall efficiency savings requirement. For 2024-25, this amounted to £62.6 million. The table in the slide shows that the ICB delivered £2.2 million more savings than required, which again has been used to help pay for more healthcare services to benefit the local population and patients. The bar charts at the bottom of the slides show that whilst the original plan was to deliver 53.7% of the savings recurrently, the actual delivery was slightly less at 48.6%, with the difference being made up from additional savings from non-recurrent schemes. This slide shows the ICB spend target on core mental health services. It shows that the ICB achieved this target, spending slightly more than the minimum figure set as our target. This slide shows the ICB's cash resource target was met. The ICB would fail this target if it exceeded the cash allocated to it. As you can see from the table, the ICB used £4.268 billion of the £4.27 billion cash available. Whilst cash available but not used was £2.9 million, this is only 0.07% of the total cash allocated to the ICB. Finally, I end this section of the AGM by looking at the opinion given by the ICB's external auditors, having concluded their work on reviewing the statutory accounts. Their statement highlights that statutory accounts comply with all necessary guidance and regulations and show a true and fair view of the financial position of the ICB. The full auditor's opinion is available within the ICB's annual report.
We're coming to a close now of our annual general meeting for 2025. I hope you found the information presented interesting and informative, and thank you for taking the time to watch. If you would like to find out more about our work, then our annual report and accounts are now published on our website. My final comments today are thank yous. I want to thank all of our staff for their ongoing commitment and enthusiasm, particularly in a challenging time. And I want to say to them that every day they make a huge difference. I want to thank the members of the Integrated Care Board for their ongoing support and their commitment to a collaborative approach to health and social care within our system. And also I want to thank our partners for working with us and that shared commitment we have to improving health outcomes for everybody in our population. And I'd also like to thank our wider partnership: acute, primary care, mental health, community services, the independent sector, social care and the voluntary community sector. Our shared commitment to improving outcomes, to thinking and working differently, and collaborating on the challenges ahead gives a firm foundation to meet the needs of our population in the future. Thank you.